Healthcare costs in retirement can be substantial. And so in this video, I'm going to share some things that you maybe haven't considered on how to reduce healthcare costs in retirement. Welcome to the Financial Fast Lane. My name is Lane Martinson. Now, as we age and as we head into retirement, the cost of healthcare is certainly a risk. We tend to need more healthcare as we get older. And so now, of course, when we reach 65, we have Medicare, and you're typically going to get a Medicare supplement plan because Medicare does not cover a lot of services. And so the combination of original Medicare and a supplement plan usually is going to give you really good coverage. And there's also Medicare Advantage plans, which may be something you want to consider. So there's definitely some decisions to be made around how you're going to head into retirement regarding healthcare. Now, if you retire earlier, right, your employer health insurance may end and you may have several years before you reach 65. And so then you're looking at a private plan. But when it comes to healthcare, when it comes to hospitals, doctors and expenses, it's really almost always dealing with treating people that are sick, right? It's managing disease and the problems that we face. So what I want to talk about are some ideas I want to share with you in this video is some things that could really reduce expenses, or another way of saying that, reduce disease in retirement. And it's really about taking care of yourself better. I like to think, a lot of times when talking with my clients is they're going into retirement, I tell them you have a new full-time job. Your new job is to take better care of yourself, meaning your physical health should become one of your primary goals of what you're going to be doing every day heading into retirement, because the impact is so significant. The impact on your life and your health and your energy, it can be drastically different when we're taking care of our health. And we're able to avoid a lot of the problems that would naturally come otherwise. As we age, we go through this natural process called sarcopenia, which is a process of aging where our muscles actually shrink over time. And so if we do nothing about it, the natural process is our muscles are going to get smaller and smaller. We get weaker and weaker. When that happens, we become more prone to disease. We become weaker and more fragile, to more at risk of falls where we can have broken bones and other injuries. And so maintaining muscle, I'd like you to think differently about this and think about what you need is muscle. And a lot of times, you think of, maybe young guys lifting weights in the gym, and, that maybe seems like it's all about appearance and vanity. But I want you to think about it in the fact that you really need some muscle. You want as much muscle as you can get. And you really only get muscle through strength training. Now, walking and swimming or any kind of activity is, very great and highly recommended. Any exercise is certainly better than no exercise. But I think it's really important to have strength training. Resistance, where you are actually working your muscles on a regular basis and maintaining their strength, their flexibility. Also stretching becomes, people tend to get very not limber, right? And that also makes you prone to injuries. So stretching every day, having a really good exercise routine, and taking care of yourself is going to make you a much more energetic, healthy, happy person going through retirement. And it's going to reduce your medical costs because you will be able to avoid a lot of the diseases that are preventable with good health, routine. You may notice when you look at older people walking, they tend to walk slower. They tend to start to hunch a little bit. And the reason why their back starts to curve, the muscles in their back are weaker. The muscles in their legs are weaker. And it affects just even the way they walk, right? And so I've shared with you and done some videos with my friend Dave Kagi. He's the guy that I met when he was 93, and I actually met him in the gym. And at the time, I thought he was, when I saw him, just the way he carried himself and walked around and was exercising, I assumed he was in his 70s, and come to find out he was 93. And, recently he had his 99th birthday. And where was he? He was at the gym. And so talking to him, he has really been an inspiration. And he points out how he really sincerely believes he would have died many years ago had he not been actively exercising his muscles and taking care of his body. And so if you kind of change the way you think about it, and I know that it can, sometimes people have a hard time wanting to exercise, but I have a saying that I use that helps me, and it's just simply this: exercise is not optional. It's not optional for good health. And so if you want good health, you have to exercise. And so, I have it on my phone. It's like I'm thinking, oh, I'm busy. I don't want to take time to do the exercise today. And then I'm reminded it's really not optional. You can't make that choice if you want good health. And so if you make the decision, I want to maintain good health, I want to keep my healthcare costs low, I want all the benefits of good health, then exercise is just not optional. It's required. The body will start to deteriorate. It really will go fast. If we just sit on the couch, if we're really inactive, it's very easy to overeat. And extra body fat has the opposite effect of muscle. It actually enhances your ability for more disease. It creates more inflammation in the body, and you will age faster. If you're carrying extra weight, you're going to get older faster, physically speaking. And you can fight that. So my hope in this video is just to be inspirational, is to set some goals and just to realize you can do a lot to change the nature of your health condition. There's so much that, the impact is real. It's real in terms of money savings. It's real in terms of just energy and feeling good and enjoying life. Another thing to keep in mind is that we really need good nutrition. And specifically, you have to have a good amount of protein every day in your diet. And it's not always easy to do, but if you know that not getting good nutrition and proper protein and amino acids, your muscles aren't going to grow, or they're going to shrink. And so good nutrition and exercise just can have a tremendous difference on your life. Now, if there's only one person watching this video that this inspires and it kind of changes your perspective to say, I have a lot of control over the future of my health, my healthcare, by what you decide to do. And if just one of you is inspired to with more determination to really take control of your health, be careful with what you eat, regularly exercise, and make sure you include strength training, you're going to feel the effects. And if just one person does that, I'm going to be very happy. This video was a success. So I hope you found this inspiring. Probably not what you were expecting on this video, but it really does make a huge difference. And so I hope you'll consider these things. I really appreciate you. Thank you. And I look forward to seeing you in the next episode of the Financial Fast Lane.